As our kids compete in their fall sports seasons, we root for them, we encourage them, but are we doing everything we can to keep them safe from injury? Here with more is Dr. Irfan Chippa, sports medicine physician with Rothman Orthopaedics. What are some of the injuries you see in athletes who participate in fall sports?
So the main sports in the fall are football and soccer, and as you can imagine, we see a whole slew of injuries. So if we start from the top, the head injuries that we see are concussions. If we move to the shoulder, you see shoulder dislocations, you see clavicle fractures, you see AC joint separations, and there's also labral tears. If you go to the hand and wrist, you see wrist fractures. For the hip, we see hip pointers, which is a very common injury. Now, the knee is the one that sustains a lot of injuries. So we see ACL tears, we see PCL tears, MCL sprains, meniscal tears, and the most devastating injury would be a knee dislocation. And for the foot, there's ankle sprains, which is very common.
What can we do as parents, as coaches, and even as athletes to try to prevent some of these injuries?
The biggest factor that has helped is rule changes, especially for concussions, because it limits exposures. You want athletes to warm up before. They would do a lot of stretching before, but we actually encourage doing light aerobic exercise that can really warm up the muscles. Incorporating strength training and stretching. So strength training specifically in female athletes has shown to reduce risk of ACL tears, because if you strengthen the hip core muscles and increase quadriceps and hamstring flexibility, you have less knock-knee position when they land, and so that could prevent ACL injuries. Also, hydration and nutrition is very important. Wearing protective gear, and most importantly, if you're hurting, make sure you get evaluated by a sports medicine physician.
Absolutely. Don't try to play on even though you want to. It's not worth it. All right.
Exactly.
Thanks so much, Dr. Irfan Chippa of Rothman Orthopaedics. I'm Robin Stoloff, and you're living well.